let's see this picture. What is shown in this picture? See carefully what is there. Now, these are shiny nails. These are shiny and polished nails. Why we see shiny and polished nails? Generally, we see these nails because of patient scratching with this movement. Patients who got itching, they tend to have two sort of scratching movement. One is with the sharp edge of the nails like this. The other one is like this. So if the patient develops pruritus, the patient may scratch like this and develop these shiny nails. Now we see what are the different reasons for the shiny nails. They may be seen in certain endocrinological conditions. For example, they may be seen in hyperthyroidism, they may be seen in hypothyroidism, they may be seen in diabetes mellitus, they may be seen in hyperparathyroidism. You see, in fact, any condition which causes hypercalcemia can result in pruritus. Then patients with hypoparathyroidism can develop pruritus. Similarly, patients who got Sippel syndrome, that is multiple endocrine neoplasia type 2A syndrome, in which there is medullary carcinoma, pheochromocytoma, and they may have hyperparathyroidism. So these patients can have pruritus. And then there are hematological conditions which can result in pruritus. For example, iron deficiency anemia. Patients who got hypereosinophilic syndrome, they have pruritus. And then patients who got essential thrombocytosis or essential erythrocytosis, that is primary polycythemia rubra vera or primary thrombocytosis, they can have pruritus. And then patients who got myelodysplastic syndrome, they can develop pruritus. So these are different hematological conditions. And then certain malignancies can cause pruritus. Malignancies, they include the different type of lymphomas and leukemias, they can cause pruritus. Then patients who've got myeloma or paraproteinemias of other type, they can have these pruritus. Patients who've got carcinoid syndrome, patients who've got solid organ malignancies, for example, tumors of the GI tract, tumors of the central nervous system, patients may have tumor of the lungs, they can cause pruritus. And then patients who've got cutaneous T-cell lymphoma, they can also have generalized type of pruritus. Now, these conditions are different from the local skin causes of pruritus. For example, we do not include scabies in this. So these are generally the systemic causes of pruritus. That is, the internal organs are involved and they produce this pruritus. And then you can have in certain miscellaneous conditions, for example, drugs. Drugs can cause pruritus and they may be without other manifestations, like there may be no skin manifestations other than pruritus. And then patients with certain intoxication, for example, mercury, or patients if they have diaminodiphenyl methane intoxications, then infections and infestations, they can cause pruritus. These are not skin infections. For example, patients who got HIV/AIDS, patient who got hepatitis C, patients who got parvovirus infection, patient may have infestation with trichinella, patient may have infestation with pinworm, Giardia ascaris. So these patients can also have pruritus. Similarly, the patients with brain abscess, sometimes they present with pruritus. And then patients can have mastocytosis, they may have eosinophilia myalgia syndrome, they can develop pruritus. And patients who got sarcoidosis or primary cutaneous amyloidosis, they can also develop pruritus. And then similarly, other miscellaneous conditions include autoimmune disorders. Patients with systemic sclerosis, dermatomyositis, systemic lupus erythematosus, Sjogren's syndrome, even multiple sclerosis, patient can develop pruritus. And then patients who got neurofibromatosis, patients who got hemochromatosis or cholestasis for whatever reason. It may be acute cholestasis, which is seen sometimes as cholestatic phase in acute hepatitis or in chronic conditions like autoimmune conditions, for example, the primary biliary cholangitis or primary sclerosing cholangitis, or obstruction of the larger ducts by conditions like malignancies or stones, they can result in pruritus. And then starvation and dumping syndrome. Similarly, patients who got fibromyalgia and chronic fatigue syndrome, they can develop pruritus. And finally, patients who got adrenergic or cholinergic type of pruritus can also be seen. So these are different type of pruritus in which we can see shiny nails, and they are generally because of the systemic disorders rather than the diseases which are only limited to the skin.